You've done the research, chosen the surgeon, and undergone the procedure. But did you know that what happens in the first 14 days after surgery can make or break your final result? Most patients focus on the incision, but the real secret to a smooth, sculpted outcome lies in a system you can't even see, your lymphatic network. Today, we're joined by Stephanie Freudenberger, a premier expert in postoperative recovery, to discuss why standard rest and compression simply aren't enough. We're revealing how manual lymphatic drainage can slash your recovery time, eliminate painful swelling, and prevent the fibrosis that ruins a perfect contour. If you want to see your results faster and feel better sooner, this episode is your recovery roadmap.
Welcome to the Doc Dudes, your premier podcast for a behind-the-scenes look at the latest in aesthetic medicine. Hosted by the cosmetic surgeons at Garrett Harper Cosmetic Surgery in Charlotte, North Carolina, the Doc Dudes brings you interviews with insightful guests, expert tips from experienced medical professionals, and lots of laughs along the way. And now, here's Dr. Garrett Harper and Dr. Evon Zoog, also known as the Doc Dudes.
Welcome to the Doc Dudes. I am Dr. Garrett Harper, joined by my partner,
Dr. Evon Zoog.
Both board-certified plastic surgeons. And today we are super excited to have a very special guest that has really changed the recovery for our patients in the last year, Stephanie Freudenberger. It's great to have you, Stephanie.
Thank you. I'm so happy to be here.
Yeah, absolutely. So, Stephanie, I think if you listen to kind of the hook before, helps us with postoperative recovery, specifically with lymphatic massage therapy, which I think finally, Evan, is like starting to gain traction. There have been tons of doctors who were doing, major, large volume liposuction cases, of course, that then kind of started trickling down and morphing into the Brazilian butt lift, which is where you process that fat and put it somewhere. It can be the rear end, can be the breast, can be the face, can be all sorts of different places that require it. But I think that the large volume liposuction guys who are doing these major cases realize, because 10 years ago I'd see them, and these people would come up from Miami or wherever they went to go get large volume 360 lipo and Brazilian butt lifts and that kind of stuff, and they would come and their butts look big, but their liposuction areas look terrible. And they would come in different garments, probably garments that weren't the correct garments. And so I think it just had to evolve, because I think people were getting a lot of fibrosis in the areas, which for patients that don't know what fibrosis is, that's just a bunch of scar tissue, right? And I mean, with liposuction cases, with body contouring, there are hundreds of thousands of little channels that we create through liposuction. And so there's hundreds of thousands of opportunities to get scar tissue. So I think it's even more kind of critical. And I think once they started implementing some of the lymphatic massage therapies, they were getting softer results, less scarring, just a much better look, a much better feel. So we all listened to those people, and now we've incorporated it in our practice. You've been here 3 years, and it's certainly become a huge mainstay of it. I think what I like to quote patients is, 50% is what we do on the table and 50% is what you do afterwards. So,
yeah, I totally agree. I mean, body sculpting through liposuction is still evolving and improving.
Sure.
But it definitely has improved a lot since we've started incorporating lymphatic massage for these patients.
Yeah, huge. And so Stephanie kind of came to us, a little over a year and a half ago. We're kind of new to the area. And then, but she's an occupational therapist, nearly 20 years of experience. That's a long time. You don't look like you could have 20 years of experience with
Sounds
anything.
like you're calling me old.
No, I'm not. I'm saying wow, if we're not your plastic surgeons, whoever is fantastic, because you look terrific, or it's just great genes. And is dual certified in lymphedema and plastic surgery therapy. So she's the owner of the Smooth Recovery in Charlotte, North Carolina, a specialized mobile service, right? Meaning she'll actually come to you, which has been amazing for our patients, because a lot of them are just kind of in the recovery situation. And I feel like they're willing to see you earlier if you're willing to come see them, right? They may not feel like getting in their car and going for a drive or something like that. So you've really changed the game for us, because you're going to see these patients, on the earlier side of things, which I think is just getting them quicker recovery and better results altogether. So tell us a little bit about yourself, where you're from, kind of what got you interested in this, and what your practice offers patients in the area.
Yeah, so I am actually from New York. I used to work in a large hospital in Manhattan, and I worked a lot with breast cancer clients and people who were still coping with some of the things that they may have gotten from their breast cancer treatments. And one of those things is lymphedema,
Sure.
which is a chronic swelling of a extremity or a trunk. And from there, I became certified in lymphedema therapy and really loved it, and also started working with elective surgeries. And that's where I found my love for plastic surgery clients. And when I moved to Charlotte, that's what I decided to focus my practice on.
So would you agree kind of with the timeline that we were talking about, that, 10 years ago, maybe this wasn't quite as instrumental and integrated as part of their, we tell all of our patients, we actually give them your handout when they're here for their pre-op, and make sure that they actually schedule with you, because we know that you're crazy busy. And it's like, look, if you want to get with her in the next week or 2 weeks, which is the latest we want you to start doing these things, then they need to go ahead and schedule their appointment, months out for you. So, but do you feel like maybe the last 5-10 years, this has really started to catch on with just kind of, your average plastic surgeon in the country?
Yeah, absolutely. The idea of a lymphatic system, a lot of the studies have been the past 25 years. Sure. And so 10 years ago, when I was doing lymphedema therapy, people had no idea what it even was. They hear lymph and they think cancer or other illnesses and things like that. They're not thinking swelling and rehab and, recovery from surgeries. Right. So science is just going fast. The research is amazing, and people are really seeing the benefits of what lymphatic drainage can do for postoperative clients.
Yeah, because for what a lot of patients may not realize is that, we make an incision and we're cutting through the lymphatic channels that have been draining that area and have been preventing it from being swollen or edematous. And so you kind of re-circuit that, right?
Yeah.
Like you're kind of helping those areas find their new route. It's like I'm driving up to Chapel Hill and there's a bunch of traffic somewhere, and Waze tells me to get off and go through kind of another area before I get back on the highway again. You're the Waze for the human body.
That's right.
Isn't that fantastic?
It is.
Super cool. So let's talk about the lymphatic system. You touched on it a little bit as far as swelling and the drainage system. So Evan, if you kind of talk about just what's the, kind of just steal your thunder a little bit with my Waze thing, but tell us a little bit about the lymphatic system and just, what it does. We all know arteries and veins and nerves, but nobody ever pays attention to lymphatics.
Yeah.
I think you're right. I think we don't pay attention until it goes wrong. Right. And so that's either in patients that have had mastectomies or other kind of situations that typically have lymph nodes removed out of their armpit and have radiation therapy. And those were the patients that were having 40, 50, 60% having this kind of chronic swelling and required these therapies. So thankfully, there's not as many of those patients that we're doing now. But certainly we have seen that lymphatic massage for our cosmetic patients is getting rid of that fluid that otherwise would collect within the tissues and can cause pressure, tension, irritation to nerves and all that kind of stuff. So Evan, what is the lymphatic system? What even is it?
Yeah, so we can, talk about the science and go through that if we want, but that's not very exciting. Basically, there's fluid inside your cells and outside your cells.
Yeah.
And when you have surgery, you disrupt that normal equilibrium and fluid builds up, and you got to get that fluid out of there. And I tell all my patients that if you don't get your lymphatic massage, your result is not going to be as good.
Yeah.
And I used to, when I first started my practice, some patients would do it, some wouldn't. And I can tell the difference.
Sure.
And they can tell the difference.
Yeah.
And so I tell everyone that now, and I'm very strict about it, about having them do that at least a couple times after surgery, because it does make a big difference.
I also think it's great though, because, Stephanie, you can kind of tell me, I'm sure you get, not from us, but I'm sure you get patients from other plastic surgeons that are in compression garments that are just totally wrong.
That's right.
And
yeah.
so the best thing about getting on with you and getting in with you is that they know they not only get like the manual decompression of their swelling, which is going to reroute things, and then the body has kind of memory on that, and those channels will open up and allow them to kind of handle their swelling on their own, which is ultimately the goal. But they also get to see you over like a several month period, if they do it the right way, and you can kind of help them graduate to different garments because the plastic surgery procedures and all that kind of stuff. So how critical are the garments for these patients, and are there any like rules of thumb that you have as far as ones you don't like, ones you do like? Do they need to, if I do liposuction on somebody's thighs, do they need to have a garment that goes all the way to their ankles? Like just those little caveats for people, if you could give us a little bit of that.
Yeah. So actually compression is like a very critical part of kind of maintaining the fluid that we're draining out of the area. We don't want that fluid to come and pool back in. And once we've kind of done some manual lymphatic drainage, we've cleared some of the fluid out, and people can get into their compression more comfortably, actually.
Yeah.
But a value that I can provide is seeing clients in their compression, seeing them take all their compression garments out in their home, laying them all out, and we can pick the best one. It has to fit well. If compression does not fit well, you're going to create areas of pressure, increased fluid, pockets of fluid, and it can do more harm than good. So it should be snug, but not too snug.
Right.
It needs to cover.
A gentle hug.
Yeah, it should feel good.
Yeah, nobody's bear hugging you.
You have to be able to breathe.
Right.
You don't want to have like acid reflux from it being too tight.
Right.
And you want to have, the surgical areas have to be covered in compression, and ideally the joint above and below it.
Yeah. It's kind of like a cast, right? Like if you get an injury in your forearm, you want to like mobilize the wrist and the elbow and those types of things, right? So I think that what I hear from some patients, so you can kind of dispel this rumor, is, they've had this surgery, they feel bruised and battered, they're hurting. They're like, you feel like you ran over me with a Mack truck, Dr. Harper and Dr. Zoog. I don't like you very much. And I tell patients, I'm like, after a lot of these surgeries for the first week or two, like I'm not on your Christmas list. You're gonna not like me anymore. But then as we get further along, I'll get back on that Christmas list, right? So what they worry about is they think about the times that they go get those deep massages, those like Swedish deep tissue massages, and they have to tell the masseuse like, oh, little less, right? And they're just like, why in the world would I have anyone touch me right now? It's the last thing I want. So can you tell them a little bit about what the process is like with lymphatic massage therapy?
Yeah. So I actually always say like the worst part is getting on and off of the table, and I will help with that.
Yeah.
But the actual manual lymphatic drainage, sometimes I call it MLD. So I'm just going to be calling that for short. It is soft. It is so little pressure. People are always surprised. It is gentle. It is soothing. It's rhythmic. A lot of clients fall asleep during the session.
Wow.
It really relaxes their nervous system. It just feels good.
Yeah.
It is not deep pressure. It's not aggressive. It's really quite lovely.
So why is that different than, the South American philosophy on lymphatic massage is a little bit different, right?
Yeah, I guess
it's a little bit more aggressive with how they do it. And so what's the difference there? Why is that?
So I think there's, I actually get this question a lot. And I definitely think that there is a time and a place for either, but the post-op period is definitely a time to have a Vater style manual lymphatic drainage. Mm-hmm. And Vater is just the name of the doctor who invented it.
Yeah.
So what it is, what true manual lymphatic drainage is a gentle skin stretch in a certain direction. And we're rhythmically bringing manually the fluid towards the healthy lymph nodes. And it's just supportive. And we're helping the lymph vessels open, collect fluid, and bring them to the lymph nodes where they filter, process it, and your body eliminates it in a very gentle way. It's very supportive. And then the Brazilian is great when you're like, a year, 2 years post-op, and maybe you want to look great on the beach or for some pictures. It's very vigorous. It's deep. They are very kind of not aggressive isn't the right word, but they're really going deep to push fluid.
So it's not really a post-operative thing.
Not at all.
Okay.
And the results look great. Like you see the pictures, they look really good for that day.
Well, what about like those people that do those wraps, like where they wrap themselves to lose a lot of their body weight so they look skinnier for like whatever event they're going to?
I want to see them 3 days after.
Right.
Because then your body is going to be back in that inflamed state
Right.
and even worse than how you started.
Yeah.
And the thing with a lot of the Brazilian lymphatic drainage is you have to be very consistent with it. It's temporary.
Yeah.
It doesn't last. But the manual lymphatic drainage, if you stay on top of it and you're consistent, you do alleviate all the post-operative swelling.
Yeah. I think I'm obviously showing my age here, but like there used to be in the back of magazines, hold on, but give me some leverage here. There used to be this advertisement for like the Hollywood cleanse, and it was how to lose 7 or 8 pounds like in a day or two before you go to something. It was Go Lightly. It was like colonoscopy prep. And that's all it was, right? And you were like, oh man, like we can do a lot with water balance in our body and all this kind of stuff. They basically just like pooped their brains out for forever and like lost that 7 pounds. And all of a sudden they feel like they've got a skinnier stomach for whatever event they're going to. So
You'll have to do that before Dancing with the
Right?
Stars.
That's exactly right. So there's a lot of like, kind of craziness out there as far as those things go. But the mechanics behind lymphatic massage, right? The reason why we get patients early is because it's going to reduce that fibrosis, that scar tissue that we've talked about, that I used to see when patients would be back here. They had some major contouring done, typically in Miami or elsewhere, and they would come up and they'd be 4 weeks out. And they would like take off their garment and their skin looked leathery. It looked like crazy. It was all kind of pinned down. And what I tell patients is I'm like, overzealous liposuction, like over aggressive liposuction, we need fat in between our skin and our muscles. If we don't, the undersurface of your skin is going to stick down to your muscle, fibrosis with scar tissue, and it's going to look like somebody, just like a hailstorm happened on your abdomen. We see a ton of that in like 20-year ago liposuction, where we didn't have the advent of having ultrasound, Vaser or any of these type of power-assisted liposuction things, which have helped the contouring out so much. And so it's like we've evolved from this very kind of, aggressive, almost archaic.
Just getting rid of all the fat.
Yeah.
That was what we used to do.
Yeah, I mean, people should be like, I don't want any fat.
And now you're literally sculpting the body.
Right.
I mean, there's negative spaces, positive spaces that you're really
There's
sculpting.
hills and valleys.
Right.
Yeah.
You're sculpting the tissue to the underlying anatomy.
And we're able to do that through processes that are gentler on the body, right? Like the use of ultrasound with Vaser. And even some of the skin tightening techniques that we can use with Renuvion or Morpheus or those types of things. And then you add on as like the kind of the pièce de résistance for all of this is your work, right? And that's like moving that fluid out of there, because that fluid is what incites the scar tissue and the fibrosis. So you're able to help define the contour better. Getting that fluid out from the tissues is also going to help manage their pain better, which is critical because we don't have that swelling in the tissues where those nerves are, and it's not putting pressure on those nerves. Right. Yeah. All right. So talk to me a little bit about the timeline, because I'm still kind of like, when people say it's a great idea to go before surgery, I'm like, really? Like, do we really need to do that? Like, so I'm here to learn from you. I'm here to, it's like I sit down and it's like, change my mind. Right. So you don't need to have lymphatic massage therapy before surgery. Change my mind.
I don't know if I'm going to. I actually think it can be beneficial. You're kind of activating your lymph nodes, you're clearing your system, you're preparing it to accept all this fluid that it's about to take. Is it necessary? No. Okay. I would save it for the post-op visit if you were concerned about, budget and things like that.
Definitely, yeah.
There are other things you can do to prepare before the surgery. Hydrating really well.
I was about to ask that.
Walking. Yeah. So our lymphatic system doesn't have an active central pump like a heart. And so the way that it gets pumped through our body is through muscles. So when our muscles are activated and our joints are moving, we're activating our lymph node sites.
That's great.
So gentle walking, dancing, swimming, all great exercises, nothing aggressive, no HIIT classes or things like that, just gentle walking.
Sure.
And then there's a routine that you can like gently stimulate your lymph nodes just by rubbing them.
Okay.
And then that kind of it changes the pressure there and lets them accept more fluid from other parts of your body.
So because we encourage our patients to like reach out to you within the first week, and we'll go over kind of the timing of when they need to start seeing you, we give them your number at pre-op, which is several weeks beforehand. Do you recommend them kind of calling you, or can they call you and just kind of get your
absolutely
your kind of checklist prior to surgery? And then of course it's great for them to go ahead and get that first appointment scheduled with you.
Yeah, I share all of that when clients book initially.
Okay.
So I have, patient education about diaphragmatic breathing, movement, hydration, things like that. Another big thing that someone can also be mindful of in the pre and post-op time. And like, I'm not a nutritionist, but watching their sodium intake.
Absolutely.
A lot of people are relying on like broths and soups and comforting foods that actually have a lot of sodium in them. And so that wouldn't be ideal after a surgery.
Yeah. I feel like as I've gotten older, I've appreciated that more when people start talking about, I must have had a lot of salt in my meal. I'd be like, what's wrong with you? In my 20s, I'd be like, what? I'm the same no matter what I eat. Now it's like totally different. Yeah. All right. And then talk to us about the post-op window. They just had their liposuction. They just had their tummy tuck. Whatever. There's tons of procedures, right? Facelifts. This is great for brachioplasties, arms, thighs lift, like all of those things, use the lymphatic system. So it's great to have you kind of on there. But when do they need to like try to see you?
So it's so gentle when done correctly that you could do it 24 to 48 hours after a surgery.
Yeah.
I feel like for me, the 3 to 5 days is better. Clients have a chance to just really rest after their surgery.
Sure.
And that's kind of when their swelling is peaking. And so kind of getting in there is a great opportunity to start. I always use the analogy that the manual lymphatic drainage is like opening a drain when your faucet is still running.
Yeah.
And your faucet is going to continue to run. You're still going to have fluid and inflammation and swelling, but we're opening up that drain so that your body can handle it better and fluid's not sitting there. So the earlier we start that, the better. That
kind of fits because I always tell patients in the first 48 to 72 hours, like that's maximum swelling, right? Like we do surgery and there's no swelling. There's like the absence of that until we hit like time 0, and then they're going to swell up. So it's like once they kind of get over that hump, that's when you can really start to mobilize. It's also hard to tell patients like, look, I want you staying crazy hydrated during this time too. It seems like counterintuitive, right? I feel like I'm retaining all this fluid. Why would I add more fluid to it? But really that's to like keep your kidneys going, and then that kind of pulls the fluid in, and then you're able to kind of process and start, eliminating, right? And then how often do people need to come and see you? I know everybody's different.
I know.
I get it.
It's a really hard question to answer. And I think if anyone does answer that question, they're showing their inexperience, because there's no number of sessions that anyone would need for any one procedure. I hear on social media people saying like 10 or 20 sessions for liposuction. How do you know that? Every person responds differently to the manual lymphatic drainage. And the goal is to treat them early and have them feel empowered to kind of continue to treat themselves.
I was about to ask you that. So you're teaching them what to do, and they can do a lot of this at home, right?
They get homework.
Homework. Oh man. They get beat up and then they get homework. That's going to be a rough sell, Stephanie. Okay. And so then everybody's a little bit different. Obviously, probably the larger your surgery, the more that's done for you, but there also are individual characteristics. Some people are swellers.
That's right.
Some people aren't. And you just, you kind of know yourself, right? If you hit your elbow and nothing happens versus you hit your elbow and it swells up, crazy, maybe that you're just a person that produces more lymphatic fluid, or that's just kind of how your vessels are. And that's kind of how, your anatomy works.
And I just always defer to her. Because patients will ask me, how many times do I have to do it? I was like, well, Stephanie will know when to tell you to stop.
Right.
I also think the earlier you start, the better. Generally, when we get in really early, we don't need as many sessions.
Yeah, that's good. And so then what about how often do they need to see you? Is this once a week? Is it twice a week? Is it 3 times? Is it every day? I'm sure it kind of trails off the further we get away from surgery, but is there a general rule of thumb so that patients can get in their head, man, I got to start seeing Stephanie at day 3, and I'm going to see her how many times for that first week, second week, third week? What's a good kind of rule of thumb?
The effects of the massage last for 24 to 48 hours. Like your lymphatic system is kind of stimulated for that period of time after. So I don't think that it's worth booking back-to-back sessions.
Okay.
So at least 2 days in between them.
Cool.
I think in a first week for an ambitious person who really wants to do everything they can, I would say 2 times a week, maybe 2 times the next week, and then tapering to 1 time a week. And then sometimes I'll space it. I'll say, I'll see you in 2 weeks, etc.
Awesome. They also have homework.
Yeah, they're doing homework the whole time.
I love that. That's awesome. All right, so talk to us about like some other patient questions. I'm just going to kind of fire these off to you because this is what our patients literally ask us, right? And you went over this a little bit, but like, does it hurt?
No.
Okay. If it hurts,
it's not done right.
I love that. So if people are falling asleep, it probably doesn't hurt, right?
Yeah, and it's a very soothing, light touch. And when you have that kind of like pleasant touch, your body doesn't really feel the pain anywhere else, right? So you can't have a good feeling and a bad feeling at the same time. And so actually your whole body will feel a relief from pain.
Love that. All right. And then you talked about it already with the homework. So, are there things that you're going to teach me that I can do at home to help myself and help the process?
Yeah, I do think, though, that it's important that someone is not teaching themselves off of like online or social media.
YouTube videos.
Because people are doing it wrong.
That's
and teaching the wrong. And you can really do more damage than good.
Yeah,
so if that is what you're going to do, I'd rather you do nothing.
Yeah, right.
Really.
Right.
But so the most important thing is kind of understanding, like I explain which direction we're going in.
Sure.
Sometimes we have to move away from incisions or always move away from incisions. But I'm teaching people how to stimulate their lymph nodes and to gently bring fluid. Nothing complicated, nothing crazy.
Yeah.
It's not what I'm doing,
right,
but something to carry over between sessions.
Yeah. And so between that and you kind of helping them choose the right compression garment, just how snug it needs to be at the different kind of segments. Because as you're getting rid of fluid, right, and time is elapsing, their swelling's going down. So perhaps the garment that they were in immediately after surgery isn't the one that they need at 4 weeks.
And that's why sometimes you might see like I'm adding foam, boards, things like that
Absolutely.
can help get the most of their money from their compression garment, but still be meeting their needs. And foam is a really great way to kind of allow the body to shrink, and the foam then fills that space in between. So it maintains the benefits of the session. Yeah.
And so what if somebody says, those doctors and Stephanie don't know what they're talking about. I don't need that. They're just trying to, squeeze me for some more money. So they don't do it. And then all of a sudden they're 4, 6, 8 weeks out and they start to realize like, wow, I don't, maybe the contour is not what I want. Maybe how late is too late?
In my opinion, about a year, like when the scar tissue is like really mature, we're really not going to be able to do much about it. So you think somebody
can come to you at 3 months, 6 months, and you can work on them?
Yeah, they're going to need more sessions. Yeah. Potentially different techniques as well. It's not all going to be that
imagine
superficial.
If you're breaking up scar, it's going to be maybe not quite as gentle. Maybe I'm not falling asleep anymore.
Correct.
Maybe there's some different massage work that goes into that. Everybody that's involved in a patient's surgery and their recovery works together. Like obviously you need a quarterback in this whole thing, but we try to make sure that the patient is doing what they're doing, the surgeons do what we're supposed to do, and then the aftercare is what it needs to be, right? Like that's the comprehensive plan. We're not here to just do surgery, send you home and just kind of thumb in the wind it and just be like, oh, we'll see kind of how everything works out. We want to make sure that patients understand that like there are things. It's not just diet. It's not just hydration. It's not just taking care of their scars with tape and scar gel. When we're doing the level of contouring and body modifications that we do for these patients, it's critical that they add lymphatic massage therapy, what you do, as a component to that. So it's really great that we've partnered with the Smooth Recovery, and the fact that you, which I think is incredible. I remember when you came to us, you said, I'll go to patients' homes. And we were like, we're about to have a lot of people who want that. So, that's huge that you are willing to go, set up your table, set up your shop, go in the comfort of their own home and help them out with this, which is just great. And then, I have 100% seen in the last several years as I've become more dogmatic about patients doing this and budgeting for this, and I have them call you so they know how much it costs so that they can kind of work it out and figure it out and see how they're going to do. The results are just mind-boggling better. Just so much better. Tell me one last thing that like people talk about sometimes, cupping. Like, does that have a place in lymphatic massage therapy and in recovery after surgery? I mean, we see like swimmers and professional athletes that like, you know, you can see their back or their legs and they've got all these little suction marks on there. But like, I've had patients come in that have worked with you and said like, oh yeah, we're doing cupping to this particular area. Like what's the cupping for?
Yeah, so it's going to be a little bit different than that Eastern medicine where you leave it on for a prolonged time. That's more energy and circulation work. But if you think about everything that we kind of do in the later phases, not immediately post-op, everything we're kind of compressing. They're wearing the compression garments. You're massaging over it. Everything is downwards direction. Yeah. And we use these little silicone cups. And we can lift the tissue. And that's another way to kind of stretch the tissue and gain space between tissue that might be adhered down. Yeah. And then also allow better lymphatic flow. I can take this suction and create negative pressure to kind of draw the fluid where I need it to go with more pressure than my hands can actually lift.
Yeah. So it's just like when you work out with like a person who's a functional trainer and they start telling you, dude, all your exercises are pushes. Like you got to do some pulls. Like you got to have that kind of healthy balance to get proper circulation and proper lymphatic drainage, right? Anything that you see on the future that's like changing kind of any modalities? Are there any tools, instruments, machines, devices, anything that you think is super interesting and you may, you know, if the science and data is out there, you may be wanting to kind of implement it into your own practice?
Yeah, I think there's some really cool things going on with compression. There are some companies that are adding beads that follow lymphatic pathways or textured 3D kind of fabrics. So they're incorporating lymphatic flow in the compression garments.
It's incredible.
I know. And some of them are now creating, there's an athletic line in particular, but they're now creating post-operative lines. And so I cannot wait to see those.
That's brilliant. I love that. Okay, tell everybody where they can find you, because some people may not even be our patients. They may not even come in. They're just listening to this, but they're having surgery somewhere else. And, you know, I think I speak for Evan and I and most of the plastic surgeons that I'm friends with here in town. We just want everybody to get a great result. We want everybody to have great plastic surgery. We want everybody's experience to be great because it only kind of helps our cause, right? Was it say something about rising water? Something in ships. There's some old wives' tale in there or something like that. But tell us a little bit about how people can look you up and learn more about your services and how they can get engaged with you.
They can find me on my website, thesmoothrecovery.com, or on Instagram @thesmoothrecovery, or they can reach out to me directly. My phone number is listed on my website, and I'm happy to answer any questions.
Love that. Well, thank you so much. All right. Your voice matters to us. If this episode sparked a question or if you have a topic suggestion for a future episode of the Doc Dudes, don't hold back. You can easily reach us through ghsurgery.com. Just click the dedicated Doc Dudes link on the homepage to submit your input and questions. Make sure you're subscribed so we pop up automatically. We drop fresh episodes on the last Tuesday of every month. Find us wherever you listen, Apple Podcasts, Spotify, iHeartRadio, YouTube Music, and more, and right on our very own website. Finally, keep up with everything happening at our practice and get episode updates by following our Instagram and Facebook page. Stephanie, I cannot thank you enough for being here and teaching us about lymphatic massage therapy. And truly, you know, a 30-minute podcast doesn't do justice for the improvement that I think you've helped our patients get. You know, you take a really good result and make it an incredible result, which is super important to us and important to our patients. So I want to personally thank you. I know Evan does too, but this is Dr. Garrett Harper signing out for the Doc Dudes, along with
Dr. Evon Zoog
and our special guest,
Stephanie Freudenberger.
Thanks, guys.